Hi, I'm Dr. Lila Abbate and I'm a physical therapist.
I'm Casey Owens and I'm a personal trainer.
And today we're taking basic gym exercises and doing a physical therapy tweak on them. So we're going to give you a way to strengthen your transversus, which is the muscle that kind of wraps around the lower part of your abdomen and inserts actually on your spine. And so then Casey's going to come on down. First I'll just show you where the transversus is. It's located from like the belly button down, and it kind of wraps around like a girdle and goes all the way to the spine. Then I'm going to have Casey hold on to her hip bones, which is the front of your pelvic bones. It's called your ASIS. And here that's the area in which she knows how stable she is and how she's able to then progress her own exercises. So from here, when I have her move into a position called tabletop, she comes into a 90-90 position. She's going to get her back not as flat as she can on the floor, but you want somewhere in between. And from here, then she pulls her abdominals in toward her spine, so she's creating a nice cinching and tightness. And then from here, she's going to keep her bones from moving, keeping them stable, and then tapping one heel down at a time. And so that if she would notice that she starts to move a little bit, she'd be able to then only move until she feels no movement, which I know sounds kind of tricky. But the idea is that your pelvis is staying stable, you move a leg, and when you move the leg, you don't want your pelvis at all to move. And so then if you start to feel it move, you pull your knee back to the starting point. So this is the starting point. So when she moves her left leg, we don't want movement in the opposite side. So now she's going to move this leg, we're going to watch that hand, and she has no movement, she taps her heel, and then she comes back up, and that's great stability. And you'll notice that maybe you're doing this at home and you can barely move before the bones start to rotate. Other side. And she's going to tap again, and then come back. And you'll see people in the gym, they don't stabilize anything, they're just kind of moving their legs all around, and that's way too much movement, and you're really training the muscle to be inefficient. So then that's not helping your back pain, it's not helping your core strength, and so here we're being very specific. So a second way to do progression on this would then be to tap her knee heel down and then move her leg out straight and then come back to bent and then all the way up. Perfect. Then she'll do the other side, and again you don't want any movement here at the fingertips, you're watching the opposite side, and then she's going to bend back and then up to tabletop. And that's a perfect position. She's able to do that really well. So try that at home.